What strikes me most is that I still have to answer this question. I've been answering this question now for probably 3 decades, and the answer is very simple: 40, not 50. There's actually a hashtag on Twitter, 40, not 50. And while the Society of Breast Imaging and the American Society of Breast Surgeons guidelines recommend yearly screening mammography starting at 40, many other societies don't. So why is that? So if you start to read the papers and read the science, they all say yearly screening mammography starting at age 40 will save the most lives. So why don't they recommend it for the 1 out of 6 women who will get breast cancer in their 40s? Well, one thing, if you want to be kind, you're going to say they don't really understand the literature, because it's very complicated literature, and they don't understand how mammography has changed over the decades since the randomized controlled trials of mammography were done. So we went from analog mammograms, that's like having your film developed in those 35-millimeter cameras that those of us who are old enough to know had, to going to 3D mammograms that we do now. Maybe they don't understand the literature. But then they also talk about harms of mammography, and the one that they really like to focus on is anxiety. Somehow the people that are writing these guidelines have images of us all on fainting couches and collapsing because we had a mammogram, and maybe we had to have an ultrasound or get called back, or maybe had a biopsy. I personally find that very offensive for a group of usually older men to be saying that women are too anxious to get a mammogram. They'd rather us have late-stage disease. And Dr. Port's research that she did with a number of us have shown that if you find your cancer by imaging, it will lead you to less mastectomies, less chemotherapy, and less surgery in your axilla.